Hello viewers, this is your primary or preventive healthcare advocate, Bernajis. You can simply call me Bernajis. I am the founder and the director of the health organization Bernajis Preventive Health Education. I'm also the author of the public-friendly medical book titled The Role of Public Medical Knowledge in Disease Prevention and Treatment. I am a nurse clinician and I work in one of the teaching hospitals in the country. Well, we are looking at the disease topic, diabetes. In my past presentations on the topic, we look at what diabetes is and what diabetes is not. We discuss some terms in relation with the disease topic. I talk about what blood sugar is. We also discuss the two ways of monitoring blood sugar, which are fasting blood sugar and random blood sugar. We also discuss the two types of diabetes we have, which are type 1 diabetes, also called juvenile diabetes, and type 2 diabetes, which is also called adult onset diabetes. We discuss all these areas of the topic. So if you really want to understand these areas that I have mentioned, I urge you to visit my page on Facebook at Bernajis Primary Healthcare Media and watch the previous presentations on the topic so as to build your understanding moving forward. We also look at the cause or the risk factors of diabetes, and that is where we made mention that we don't have a direct cause of the disease diabetes. You can't pinpoint one particular element or factor as the cause of the disease diabetes. As in the case of diseases like tuberculosis, malaria, pneumonia, we have known direct cause of these diseases, but that is not in the case of a disease like diabetes. But we only have risk factors. We only have risk factors. And the risk factors, as the name suggests, they only put a person at a certain level of risk of getting the disease. They only make it easier for a person to get the disease, but they do not directly cause the disease, as in the case of malaria. So at the point of discussing the cause or the risk factors of diabetes, I lay much emphasis on the fact that sugar or sugary food is not the direct cause of the disease diabetes. Yes, the consumption of sugar or sugary food is not the direct cause of the disease diabetes. This is because a lot of people over here in Ghana, let me say, believe or they have the perception that eating so much sugar or sugary food is the cause or the direct cause of the disease diabetes. And I blame this wrong understanding or perception on the kind of local name that we give to the disease diabetes over here in Ghana. Over here in Ghana, the local name that we have for the disease diabetes, when you translate it into English, it literally means sugar disease. Yes, the dietary sugar, so sugar disease. The Ghanaians call it Sikrihila. The airways in the Volta region, the people of Volta region, they call it Sikrido. The Akans call it a Sitriyare, which literally means sugar disease. So a lot of people have this understanding that sugar or sugary food is the direct cause of the disease. And I think they pick this kind of understanding from the local name that we have for the disease diabetes. That is why in my previous presentation, I raised the point that we really need to take a critical look at the sort of local names that we give to certain technical terms so that people will not wrongly interpret them. The same applies to hypertension. When I was discussing the disease topic, hypertension, it is called in a local language Moja Brusro. The accounts call it Moja Brusro. The airways also call it Vusugbodo, which literally means excessive blood or excess blood. When you translate the meaning of hypertension in the local language to English, it means excessive blood. But looking at the disease hypertension, I don't think it is right to call hypertension excessive blood or excess blood. That is why it is interesting for someone to tell you in a community that they said I have hypertension, which they call excess blood. So I don't have to eat I don't have to eat food that will boost my blood level. So you see, they pick the direct meaning. They pick the meaning directly from the name which we have given to these diseases in the local dialect. So authorities, the people, the leadership in the health sector have to take critical look at the sort of local names that we give to these diseases, so that our local folks will not interpret it wrongly, and it will negatively affect them too. In the previous presentation, again, I talk about the signs and symptoms of diabetes. When a person is sick, there are certain changes inwardly or outwardly that suggest that the person is sick. And diabetes has certain signs and symptoms that suggest that a person might be suffering from the disease diabetes. We discuss those signs and symptoms. We look at 4 cardinal signs and symptoms that when a person presents them, it may directly prove or show that such person is having the disease diabetes without going through some other laboratory investigations. Yes, we discuss 4 cardinal signs and symptoms associated with the disease diabetes. So to get understanding on these signs and symptoms, I again urge you to visit my page on Facebook at Bernajis Primary Healthcare Media and watch my previous presentations on the topic. You can also visit my YouTube channel at Bernajis Primary Healthcare Media to watch the previous presentations on the topic. Let's continue from where we left off on the topic. The next area to look at is complications of diabetes. What is complications of a disease? Well, I do talk about what complication of disease is in other video presentations on disease topics that I have talked about, but complication of a disease simply means, let me put it this way, a person is having disease A, he or she didn't treat it properly, or he or she didn't treat it at all. Then the disease advanced to a more serious stage, or the disease advanced to a stage where treatment now becomes more difficult or expensive. Or a person is having disease A, he or she didn't treat it properly or didn't treat it at all. Then a different disease altogether sets in as a result. That is what we mean by complication of a disease. For instance, we have hypertension and stroke. Stroke is a complication of the disease hypertension. So if a person is having hypertension and it is not controlled, the hypertension is not properly managed, it is easy for such person to suffer stroke. So stroke is a typical complication of the disease hypertension. Another one is a person is suffering from malaria. If such person didn't take the malaria drug to clear the parasite from the body system, the malaria which could have easily been treated even at home would then move to the next stage. That is the complicated stage, which is called cerebral malaria. That is when the malaria parasite now travel from, let me say, the liver and then get into the brain to give us what the disease we call cerebral malaria, which is a very serious complication of the malaria disease that most of us take for granted. Cerebral malaria is very, very difficult to treat, and it is also very expensive. So this is the seriousness of complications of diseases. Unfortunately, over here in Ghana, A lot of people don't like to go to the hospital when they are sick at the initial stage. Many people prefer to sit at home, I don't know, hoping that the disease will go away. And a lot of them also sit at home doing their own thing. They only look towards the hospital when the disease advances to a more serious stage or when complications set in. But such disease could have easily been taken care of in the hospital without spending many days or a lot of money or resources. So we need to educate our people on the importance of primary or preventive health care. I believe seeking health care at the earliest stage should be part of primary or preventive health care, because in doing so, the person is preventing complications of diseases. So you go to our hospitals, a lot of people are suffering from diseases which could have easily been prevented. You go to the hospital wards, you see young men and women suffering from stroke. Some of them were diagnosed of hypertension. They didn't take it seriously. They didn't manage it. They didn't take their drugs properly. Then the hypertension or the BP kept rising till it hits them with its complication, which is the stroke. A lot of young men and women are suffering in the hospital with chronic kidney disease because they were once diagnosed of the disease hypertension. They didn't take it seriously. They didn't manage it properly. Then they ended up with what? Chronic kidney disease. So complication of a disease is a serious problem in the health sector over here in Ghana, and I think we need to do more. We health workers, the leadership in the health sector, need to do more to educate people that diseases progress in stages. Diseases do not go away on their own. When someone is manifesting sickness, it is because the immune system or the body's natural defense against infection can no longer handle the disease. That is why the person is manifesting the disease, and the person needs extra care, extra intervention in order to take care of the disease, and that is going to the hospital on time. So we need to visit the hospital on time, treat diseases at the earliest stage in order to avoid complications. Some of the complications cannot even be cured, especially the chronic types. They cannot really be cured. So these are some of the complications of diabetes. One is blindness or eye problem. Yes, if a person is having diabetes and it is not properly controlled, if diabetes is not properly controlled, it is easy for such person to develop serious eye problem or even go blind. So I have seen a number of diabetic patients who ended up with blindness. So if you do not want to find yourself in that situation of blindness or going blind, then I urge you to take the management of diabetes seriously. If you have a loved one who has been diagnosed with diabetes, encourage the person to properly manage the disease so as not to develop eye problem or suffer blindness. Another complication of diabetes is poor wound healing. Yes, people with diabetes have issues with wound healing. This is because diabetes weakens the immune system. The natural factors that promote wound healing its effectiveness is reduced by the disease diabetes. So a person who is diabetic can have a small cut or wound on a body. Such wound may not easily heal. It is very difficult to heal. So people with diabetes have to be extra careful. They need to monitor their body to ensure that they take care of wound, or they do not even get a certain minor cut on the body, because such minor cuts can easily degenerate into a very big wound where healing becomes a problem. We have what we call diabetic foot. Diabetic foot is a serious, complication of the disease diabetes, and many people who have diabetes and they do not manage it, they easily develop this problem. Diabetic foot is having a wound on the foot, which never heals, which will never go away, but the wound will only continue to expand, the wound will continue to grow. And one problem with wound on the foot, which we call diabetic foot, the wound doesn't easily heal. The cells and tissues and muscles and all the body part at that part of the foot will begin to die off. Let me use the word rot. So you see that the foot is rotten. The foot will begin to rot. And it is not only the part that is affected. The rotting of the foot or the expansion of the wound will continue, where the wound will be moving to the upper part of the body. So the wound might be localized small on the leg, but before you realize, the whole leg, the whole lower limb is affected by the wound. That is how diabetic wound is. The wound ascends from the lower part of the body to the upper part of the body. That is the reason why it is easy for a person with such kind of wound to get amputated, because if the amputation is not done, the wound can continue to grow or expand to all parts of the body. To save other parts of the body, other normal part of the body from being damaged, amputation has to be done. Amputation has to be done. So if you do not want to find yourself in that serious or complicated stage, then take the management of diabetes seriously. Yes, people are really suffering in the hospital with very huge wound on their body because they have the disease diabetes. One problem too is that people with diabetes, when a person is having diabetes, the person becomes less sensitive to pain. So the person might be having a small cut where the person will feel that, okay, there is a pain there, but the person may not really feel the pain of the wound. So the wound will be there without the knowledge of the person, but before he or she realizes, the wound has expanded. So a healing of wound or wound healing in diabetic patients is very, very difficult. When we get to the stage of education on how a diabetic patient can live to prevent some of these things, I will elaborate more, or I will explain or talk more on that. Another complication of diabetes is chronic kidney disease. Yes, it is easy for someone with diabetes, uncontrolled diabetes. I'm using the term uncontrolled diabetes. You don't need to be alarmed. In my previous presentations on the topic, I made mention that it is not automatic that once someone is having diabetes, the person will end up suffering all these complications or problems that we are talking about. No. These problems will face the person if the disease is not properly managed, if the diabetes is not properly controlled. So if a person is having diabetes and it is not controlled, the sugar continues to rise, there is no proper management of the disease, it's easy for such person to develop chronic kidney disease. And you know, chronic kidney disease is rampant these days. A lot of people are suffering from chronic kidney disease. Yes, there are other factors or other things that cause the disease, chronic kidney failure, but diabetes is one typical one that can lead someone to getting this disease. Yes, so when you see someone with chronic kidney disease, you realize that some of them, you realize that a lot of people who have chronic kidney disease already have diseases like hypertension and diabetes. People with chronic kidney failure already have diabetes or hypertension. So if you don't want to find yourself in that situation, if you don't want to suffer chronic kidney disease, please, when you are diagnosed of the disease diabetes already, make sure you properly manage it or control the blood sugar, or make sure you take good care of yourself so as not to find yourself suffering from the disease diabetes. The next complication of diabetes is diabetic coma. Diabetic coma is loss of consciousness related to the disease diabetes. And this can be linked to two factors, which are hyperglycemia and hypoglycemia. In my other presentations on the topic, I explain what these two terms are, hyperglycemia and hypoglycemia. Hyperglycemia means excessively high level of sugar in the blood. Sugar level as high as, more than 30 millimole per liter. And then hypoglycemia is excessively low level of sugar in the blood. Sugar level as low as, 1.5 or 2 millimole per liter or 1.5 millimole per liter. These two factors can cause a person to lose consciousness, or a diabetic patient to lose consciousness or pass out. So one will say, hey, so diabetes there, if the sugar is very high, it's a problem. If the sugar is very low too, it's a problem. Yes, it is a big problem. And because of the nature of diabetes, a lot of people think the diabetes is just only about sugar rising, that is hyperglycemia. No, hypoglycemia also happens often in diabetic patients. This is because of the body is unable to regulate the amount of sugar in the body. The body is not able to use its natural mechanism to regulate the amount of sugar that is in the body. So the sugar can go very high, the sugar can also drop significantly. Among these two causes of diabetic coma, the worst is hypoglycemia. If a person is having hypoglycemia or a person is having diabetic coma due to hypoglycemia, it is more serious or dangerous or deadly than the hyperglycemia. This is the reason. You see, when someone is having hypoglycemia, severe hypoglycemia, it means that the person's body system is lacking enough glucose in the body. It means enough glucose is not in the body. And we know that the body cells, tissues are living things. Or let me say, yes, are living things, entities. So if the sugar level, the source of energy, is not there, it means that the body cells and tissues will not have access to the required amount of energy to function. The brain is one typical one. The brain uses a lot of energy to function. So if the sugar level in the body system is depleted, in the blood is depleted, it means that the brain cells will not have access to enough glucose to function. What happens is the brain cells will begin to die. That is why someone with diabetes, when the sugar level is very, very, very low, the person goes off gradually. The person goes off gradually because the brain cells are getting deprived of enough source of energy, which is from the sugar. The next point is what can make someone to have a very low level of sugar, which is hypoglycemia, leading to coma or loss of consciousness. Diabetic patients, again, should not fast for a long time, or diabetic patients should not avoid food for a very long time. This is because the body's own natural mechanism of regulating the normal amount of sugar in the blood is no more there. Yes, it's no more there. Time. So if a person is diabetic, the person can fast sometime, maybe half day, from 6 o'clock to 12 o'clock. But a diabetic patient fasting from 6 to 6, I think is not advisable at all. It is easy for such person to suffer severe form of hypoglycemia, which can lead to diabetic coma. As I have indicated somewhere in my book, I have seen a man of God, a pastor who had been rushed from prayer camp because he suffered hypoglycemic coma. So the person doesn't need to stay away from food for that long, because the body will not be able to regulate the amount of sugar in the body in order to avoid the coma. For instance, people who are not diabetic, when a person is hungry, the body has a way of releasing stored sugar into the blood so that the person will not pass out. Yes, so someone can stay without food for 3 days without any issue because the body has a way of coping with that kind of situation. But when it comes to diabetic patients, that is not the case. That is not the case. So fasting for long hours or staying away from food for a very long time can cause the person to have severe hypoglycemia leading to diabetic coma. Another factor that can cause hypoglycemia, severe form of hypoglycemia, leading to coma or loss of consciousness in diabetic patients is drug. There are drugs meant to lower the blood sugar if it is very, very high. And with diabetes, normally people have very, very high blood sugar, that especially the type 2 diabetes. So we have drugs which they take at home to lower the blood sugar if it is very, very high. Unfortunately, many people use this drug on a blind side where the blood sugar is not monitored. Yes, if the blood sugar is already low, if the sugar level is already low and then this sugar lowering drug is taken, it further lowers the sugar level in the blood, and that can lead to the hypoglycemia, the sudden serious hypoglycemic state. So it is easy for somebody who is taking some of these hypoglycemic drugs, for instance insulin, to suffer hypoglycemic coma. So sometimes I do advise diabetic patients to try as much as possible and have the glucometer, the machine used to monitor blood sugar at home. It is handy, it is small, it is easy to use when taught. So I sometimes advise people to get this machine at home so that they can monitor the blood sugar as often as possible so as not to be in a position of taking the drug even when the blood sugar is already low. For instance, if the blood sugar is around 3 millimole per liter, the person might not be feeling anything. The person might feel hungry. The person might not show the signs and symptoms of hypoglycemia. We'll be coming there. I will talk about the signs and symptoms of hypoglycemia or hyperglycemia. So if a person is having blood sugar as low as 3 millimole per liter, the person might not at that point be having any symptoms or signs showing that the sugar is low. So if the person takes the insulin, it is further going to drop the blood sugar to maybe 2 or lower than 2, which can lead to the coma. So assuming such person was about to sleep or was going to sleep, the sugar was 3 millimole per liter, and then because he or she has been told to take the insulin and then took the insulin before going to sleep, I bet you the blood sugar is definitely going to drop further if the person has not eaten before sleeping, and the person could suffer the hypoglycemic coma in sleep and even die if nobody realizes it. So that is why I said between hyperglycemia and hypoglycemia, hypoglycemia is more serious, is more dangerous, is more deadly. So it is important to monitor the blood sugar often, especially when taking these diabetic drugs which aim at lowering high level of sugar in the blood. Yes, so I do encourage people, and I am encouraging anyone listening to me, if you are diagnosed of the disease diabetes or you have a loved one who has diabetes, I encourage you to try as much as possible and get the sugar monitoring machine at home. That is the glucometer. It is quite expensive, but you cannot compare the problem that can come from not having it and taking some of these hypoglycemic drug and then finding yourself in that kind of situation. So I urge you to monitor the sugar level frequently before you take some of these drugs, I repeat. So these are some of the signs and symptoms associated with extremely low level of sugar in the blood and extremely high level of sugar in the blood. I said the person will be confused, the person becomes restless, the person sweats profusely, the person begins to get weak. Like you realize that things are not right with the person at that stage. If you have the glucose monitoring machine at home, quickly check the sugar to see if the problem with the consciousness is as a result of hypoglycemia or hyperglycemia. I don't normally suggest solution in my video presentation because it is medically not done. But in this situation, I would like to talk about a bit about the solution. If you check the sugar and then you realize that the loss of consciousness is related to low level of sugar in the blood, I advise that if the person can swallow, quickly mix sugar in water. Take the normal dietary sugar, raw sugar, mix it in water and give it to the person to drink. Or give something that can easily raise the sugar level of the person. You can take soft drink, any drink that has sugar or that has high level of glucose. Give it to the person to take immediately. That is if the person has not yet passed out. But if the person passed out, if the person has lost consciousness, please do not put anything in the mouth. Do not put anything in the mouth because the person will not be able to control or handle that drink or food in the mouth, and it can lead to what? Choking. The person can aspirate, the person can get choked, and that will even kill the person and not even the hypoglycemia. So this is the seriousness of having diabetes and not properly managing it. This is the seriousness, and then we all have to understand some of these things. We all have to understand some of these things. The next area to look at is management of diabetes or specific education for persons living with diabetes. It is necessary that some persons around a diabetic patient know about the condition. This is necessary to ensure that in the time of crisis, sudden crisis, where the patient might be experiencing a hypoglycemia, which is low level of sugar in the blood, or hyperglycemia, extremely high level of sugar in the blood, which could lead to diabetic coma, so that they take appropriate steps to prevent the worst from happening. This means that such trusted persons who should know about the condition, whether at home, at the workplace, in school, or anywhere that the patient might be spending longer time, they should be able to have some basic knowledge on the condition. They should know about the signs and symptoms that a diabetic patient presents if he or she is beginning to experience hypoglycemia, which is extremely low level of sugar in the blood. They should be able to tell the signs and symptoms of a diabetic patient if he or she is beginning to experience extremely high level of sugar in the blood, which is hyperglycemia, so that they will know the appropriate step to take to prevent the worst from happening. The next point on proper management of diabetes is consumption of sugar or sugary food. As I have said earlier on, sugar or sugary food consumption is not the direct cause of the disease diabetes. For someone to be diagnosed of the disease diabetes for first time, it is not caused directly by the consumption of sugar or sugary food. So that someone, when I go to the communities, it's easy for someone to tell me, oh, as for diabetes, or they call it citriaria, that is sugar disease, as I have said earlier, as for that disease, I don't think I could ever suffer it because I stopped taking sugar or sugary food for about 30 years now. So I don't think I could ever get the disease diabetes. That's the kind of perception that many people have about diabetes in the community, that sugar or sugary food consumption is the cause of it. But I have stressed on this several times that sugar or sugary food is not the cause of the disease diabetes. But when someone is diagnosed of the disease diabetes, he or she must be very careful about the consumption of sugar or sugary food. Yes, when someone is having diabetes, he or she must be extremely careful about the consumption of sugar or sugary food. This is because sugar or sugary food is already in a form to directly cause sudden rise in blood sugar in the body system. That is why it is necessary to be more careful once you are diagnosed of the disease diabetes. I wouldn't say a diabetic patient should completely avoid sugar or sugary food. No, I wouldn't say that. This is because there is a point where sugar or sugary food is needed to help a diabetic patient. So I wouldn't say they should completely avoid it. I said earlier on they should be very careful with sugar or sugary food consumption, but I wouldn't say they should completely avoid it. This is because sometimes sugar or sugary food is needed to help a diabetic patient. For instance, if you are at home and then a diabetic patient is having hypoglycemia or severe form of hypoglycemia, you are supposed to give the patient sugar or sugary food to raise the sugar level to avoid the patient going unconscious, which is diabetic coma. But if a person is having the notion that a diabetic patient should never have anything to do with sugar or sugary food, the patient will not receive the sugar or sugary food to help him or her at that time. So the help at that particular time is sugar or sugary food. So people should not have the impression that once someone is diabetic, the person should completely avoid sugar or sugary food, where a situation that requires the intervention of sugar, it will not be used or given. The next point on proper management of diabetes, a diabetic patient and diet or food. A diabetic patient should avoid eating food in large quantity. He or she should eat in bits and at short intervals. So if he has to eat 2 balls of kenke or banku, he or she can just eat one and then after some time eat the next when hungry. This is because, as in a case of people who are not having diabetes, the body is able to control the right amount of sugar in the blood at any point in time, no matter how much food the person has consumed. But that is not the case for a person with diabetes. There is a problem with regulation of sugar in the blood. So with the little amount of food, it can easily cause the blood sugar to shoot up. That is why we advise that diabetic patients should eat food in bits and at short intervals. They should not avoid food for a long period of time and then put everything together to consume. For instance, he or she will say, I didn't take my breakfast, so I'm going to combine my breakfast with my lunch. That is not done. When such is done, it is going to cause the blood sugar to rise sharply and it can cause problem. The patient should eat more of fruits and vegetables instead of having big bowl of banku or fufu with a lot of meat or fish on it. He or she should eat more of fruits and vegetables to control the right amount of sugar in the blood at any point in time. They should also avoid long-term fasting, as I have said earlier. Diabetic patients should not subject themselves to long-term fasting or avoid food for a long time. It can cause other serious complications associated with diabetes, not only the hypoglycemia. The next point is skin care. Diabetic patients should properly care for the skin. As I indicated earlier on, wound healing is very difficult in a person with diabetes. That is why it is necessary for them to properly care for the skin to avoid cut or wound. they should make sure they physically inspect the feet in between the toes to ensure that there is no wound or cut. I also raised the point earlier on that diabetic patients are less sensitive to pain. The disease does have effects on the nervous system, the nerves, so they are less sensitive to pain. So a person with diabetes might have cuts somewhere, but he or she will not feel the pain. So the wound will be there and then cause problem later. It is necessary for them to inspect all parts of the body, especially the feet in between the toes, to ensure that there is no wound over there that would degenerate into something more serious for them. They should also avoid the use of sharp objects to trim the nails. They should use the nail cutter, which only targets the nails and not mistakenly end up cutting any part of the body during the time of the trimming. Diabetic patients should not put on tight footwear. They are encouraged to put one that is open-ended. This is also meant to ensure that they do not develop any sort of wound or cuts on the feet. The footwear should always be dry and clean. In between the toes should always be dry and clean to avoid any sort of wound or cuts, because it is easy for the skin to break down in a diabetic patient to develop into wound. In the case of a diabetic patient developing any kind of cut or wound, no matter how small the wound may be, it should receive the utmost attention or care so as to let it heal early. The next point in terms of proper management of diabetes is regular monitoring of blood sugar. Yes, I always encourage persons with diabetes to buy the glucose monitoring machine, which is the glucometer, so that they can monitor the blood sugar regularly to know if it is being controlled or not. The best way to know if you are properly managing your diabetes is to regularly monitor the blood sugar. So if you have the machine at home, you have the opportunity to monitor it regularly. That will inform you whether you are doing well with the management or not. The machine is not that expensive. It's quite expensive, but not so expensive. So you shouldn't think of the money and then not get a machine. The problem that may come as a result of not monitoring the sugar often is more than how much you will spend in getting it. If you think you cannot afford the machine, the glucometer, a lot of drugstores around the communities have machines to monitor those who visit them, those who go there to buy drugs. So if you can't get the machine, get close to any drugstore around you. Those of them who have the glucometer, they will regularly monitor it for you. Or if you have a hospital or a clinic close to you, just go there once in a while to have your blood sugar monitored. That will give you a fair idea of whether you are doing well or not. Another point, or let me say the last point that I will talk about, is keep fit. Yes, exercising. Keeping fit is one of the most effective ways of staying healthy. If you really want to properly manage your diabetes, I encourage you to take Keep Fit seriously. As I had been saying in my past presentations, video presentations, not many people see the importance of keep fit or keeping fit or exercising over here in Ghana. Not many people do. But if you want to properly manage diabetes, then take exercising seriously. Exercise or keep fit, sweat, so that you'll be able to burn excess fat in the body to put your blood sugar in proper shape. But if you are having diabetes, you are managing diabetes, you have to do your exercising or keep fit in moderation. You don't have to overdo it to get your blood sugar run down, where you get into hypoglycemic state. So do your exercising or keep fit in moderation. Make sure you have food available before you go out to keep fit, so that you will not have hypoglycemia. Well, the last area to look at is prevention of diabetes. Can diabetes be prevented? How can one prevent diabetes? You see, diabetes is a typical lifestyle disease. It is a chronic disease, as I said earlier, which has no direct cause. So you can't really eliminate the causative agent of diabetes to get it cured. Diabetes cannot be cured. We know the causative agent of a disease like malaria, TB. So we can eliminate the causative agent for the disease to be cured completely from the body system. But that is not the case for a disease, a chronic disease like diabetes. It is a typical lifestyle disease which must be prevented if you do not want to have it and manage it properly. So how can one prevent diabetes? To prevent diabetes, we need to go back to take a look at all the risk factors that make it easier for someone to get a disease. I have talked about all the risk factors, some of the risk factors that trigger what? The disease diabetes. I made mention of family history. So if you want to prevent diabetes, know your family medical history, because diabetes can run within the family. If you know your family medical history and you notice that people easily get the disease, or people are having diabetes, your auntie is having diabetes, your uncle, your mom is having diabetes, you will be extra careful with your lifestyle. You will be extra careful with your lifestyle so that you will not easily get the disease too. Another one is diet. Yes, diabetes is purely one of the lifestyle diseases. So you need to watch your diet. Make sure you avoid excessive consumption of fatty food. Cut down intake of red meat. Eating of vegetables and fruits is recommended to prevent some of these diseases. We also made mention that obesity or putting on excess weight puts a person more at risk of developing the disease. So if you don't want to develop diabetes, put your weight in check. Do not be overweight. Cut down excess fatty food or food that will help you to put on more weight. As I had been saying in my previous video presentations, where many people in this part of the world, Ghana, assume that once someone has extra weight, it is a sign of good living. That should never be the case. You should always make sure you put your weight in check if you do not want to suffer some of these diseases. Another thing to do to reduce our chances of developing diabetes is to monitor our blood sugar once in a while. You don't need to be diagnosed that you have diabetes before you know that you have to get yourself screened. As I said earlier on, diabetes is a chronic disease, which means that the disease can stay with a person for a very long time without exhibiting any signs and symptoms. The disease can stay with a person for 10, 15 years with the person not realizing it. That is why it is necessary that we screen ourselves, we monitor our blood sugar once in a while to know whether everything is right or not. We don't need to fall sick before we do some of these things. This is what we call primary or preventive health care. Primary or preventive health care involves taking certain steps to prevent the disease altogether. Unfortunately, that is not the case over here. Many people prefer to sit down and then get disease, including its complications, before they go to the hospital. It is a beautiful thing for you to just walk to a health facility and then ask for basic screening. You check your sugar, you check your BP, you check some of the chemistries in your body system. It is a wonderful thing to do. You are just practicing primary or preventive health care. And I think these are some of the things that our big men in societies, some of the celebrities, some of the people that are role models, these are the things that they do to stay healthy. We can also do it. Primary or preventive healthcare is the cheapest form of healthcare, as I had been saying. The other form of healthcare, which is curative healthcare or secondary healthcare, is very expensive. You have to get a disease, go to the hospital to be treated. And I have been saying not all diseases can be treated. Not all diseases can be cured. Many diseases have to be managed. So I will encourage each and every one of us listening to me to take primary or preventive health care seriously. It doesn't require much. Just be health conscious. Just go for basic health screening so that everything within you will be within the normal range. In case of a problem, it will be rectified as early as possible. I've also been saying that cancer, for instance, can be cured. If you detect cancer early, if cancer is detected very early, it can be cured. If you know what cancer is, it can easily be cured. But what happens is that a lot of people sit down for the cancerous cells to spread within the body. Once they begin to spread, nothing can be done about it. But if the cells are localized, if the cancer cells are localized, it is easy for it to be taken out than for it to spread. This is the reason why we need to take primary or preventive health care seriously, where we don't have to fall sick before going to the hospital to see if everything in our body is working fine. Well, this is the end of our discussion on the disease topic diabetes. I hope you have learned something. To have full understanding on the topic, I encourage you to visit my page on Facebook at Bernajis Primary Healthcare Media and watch the previous presentations on the topic. You can also visit my YouTube channel at Bernajis Primary Healthcare Media and watch the video presentations there on the topic. Primary or preventive healthcare require what? Basic health knowledge to prevent chronic diseases that are lifestyle in nature. What you need first is proper health knowledge. So I hope you will make use of all that you have learned. Continue to watch the presentations on the topic so that you'll be able to use the knowledge in real life to help yourself.